Did you know that 9 in 10 seniors are happy with their Medicare coverage? Well, that's the good news. The bad news is that Medicare doesn't cover everything. In fact, some of the benefits you are used to having with employer coverage aren't included in Original Medicare Parts A and B. At Boomer Benefits, we've helped tens of thousands of seniors navigate these exact Medicare challenges. And we're here to make sure you don't just hope for the best, but actually get the best coverage for your needs and your budget. So today, let's talk about 6 things Medicare won't pay for and how you can prepare for them. Medicare does cover skilled nursing facility care in some cases, but it's not the same as long-term care. To qualify for a skilled nursing facility stay, your stay must follow a hospital admission of at least 3 days. And you must require skilled care, such as wound care or physical therapy, occupational therapy, not just help with daily activities like bathing and dressing. And even if you qualify, there's a hefty copay of over $200 per day for days 21 through 100. That's over $16,000 out of pocket for one fully covered stay. A Medigap plan can help with that daily copay, but it won't pay anything toward further long-term care that Medicare doesn't cover. So to prepare for the possibility of someday living in an assisted living facility or nursing home, you might consider purchasing private long-term care insurance or setting aside money in a health savings account before enrolling in Medicare. With an HSA, the funds are yours to spend as you see fit, and anything left over can be passed on to your heirs. There are also life insurance and annuity products available that may have long-term care riders. Now that you know Medicare doesn't cover traditional long-term care, you'll have the opportunity to look into solutions for this long before you need it. Original Medicare Parts A and B doesn't cover most prescriptions you get from a pharmacy. Only medications given by injection or infusion in the clinical setting are covered under Part B. Even if you have Medigap, you're still on your own for drug costs unless you enroll in a Part D drug plan. These are technically optional, but if you don't have any other creditable drug coverage, you'll face a late enrollment penalty if you sign up late. That's why most people enroll in Medicare Part D as soon as they join Medicare. Medicare Advantage plans often include Part D drug coverage, but you will need to be sure that your prescriptions are on the plan's formulary. Drug costs can change, and plans can too. Original Medicare doesn't cover medical care that you receive outside the United States of America, except in a really few rare exceptions. For everything else, you're responsible for the full cost. Now, some Medigap plans include up to $50,000 in emergency travel coverage, and many Medicare Advantage plans have limited coverage for emergencies worldwide. Still, foreign providers don't have to accept or bill your plan, so you'll likely have to pay up front and file for reimbursement later. If you travel internationally, we highly recommend buying a travel health insurance policy. They're generally affordable, and they cover things like emergency care, evacuations, wherever you are. You can run a free quote and enroll in a short-term travel medical plan at www.gobluetravelinsurance.com/boomer. As we age, our dental health needs increase, but routine dental visits and procedures are not covered under Medicare Parts A or B. And that can include things like cleanings, fillings, root canals, and even dentures. Medicare may cover dental work only if it's medically necessary, like surgery related to cancer or heart conditions, but it's exceedingly rare. Since Medicare doesn't cover your dental service, your Medigap plan won't pay toward it either. So to fill the gap, you can look into standalone dental plans or Medicare Advantage plans that include dental coverage, often covering exams and cleanings at 100%, sometimes with or without a small copay. By age 65, about 90% of us have cataracts, and many experience other vision issues. Medicare will cover vision services to treat medical conditions of the eye, like glaucoma treatment or cataract surgery, which includes one pair of corrective lenses afterward, but that's where the coverage stops. There's no coverage in Medicare for routine eye exams, new glasses, frames, or contact lenses, or any kind of ongoing vision care. Again, Medigap can't help there either, but some Advantage plans offer vision benefits, so you can consider those, or you can purchase separate vision coverage. Roughly 1/3 of adults aged 65 to 74 have hearing loss, and that number only goes up with age. But Medicare doesn't cover hearing exams, hearing aid fittings, or the hearing devices themselves. Hearing aids can cost up to $4,000 out of pocket, and you'll pay 100% of that unless you enroll in a standalone plan for hearing or a Medicare Advantage plan that includes hearing benefits. Some Advantage plans offer discounts or allowances, and some allow you to add hearing coverage for an additional monthly premium. We help clients compare dental, vision, and hearing options all the time. We can point you toward the most cost-effective standalone plans and help you understand the fine print. It's really important to comparison shop your Medicare options before you enroll in anything. For some, original Medicare plus a Medigap plan and dental, vision, hearing coverage gives the most flexibility and coverage. For others, an all-in-one Medicare Advantage plan with bundled benefits and drug coverage may be the better fit. And don't forget, if you've been contributing to an HSA, you can use the existing funds in retirement for dental, vision, hearing, and long-term care expenses. At Boomer Benefits, we'll help you compare all of your options so you can feel confident about your coverage and not confused by it. And the best part, our services are completely free to you. My team offers free lifetime client support, which means we don't just help you enroll in Medicare. We're here long after answering your questions, solving billing issues, and helping you evaluate your plan each year. So whether you're comparing Medigap options, wondering about Medicare Advantage extras, or you just want someone to break it all down for you, we've got you covered. If you want to learn more about what Medicare does cover, be sure to watch this video next.